Hello, everyone. My name is Roger Barnett. I'm the chairman and CEO of Shaklee Corporation, and welcome to our Doctor is In series. Today, we have an incredibly special guest, Dr. Kari Nadeau, who is the director of the Sean Parker Center at Stanford University, and she is also the leading food allergy scientist in the world. And we're delighted to have her. And we have a special guest to join Dr. Nadeau, who is my wife, Sloan Barnett, because Dr. Nadeau and Sloan have co-authored a book together that we will be talking about. And the book is called The End of Food Allergy, the first program to prevent and reverse the 21st century epidemic. And I think it's really incredible. And so, Dr. Nadeau, very much welcome to our Shaklee family. We have are doing this in front of our tens of thousands of our Shaklee family members around the world at our first Shaklee Global Virtual Convention. So we're very excited for that. And let me start off by asking a question to your co-author, Sloan. Sloan, I obviously know about this project, but why don't you share how you met Dr. Nadeau and how this project started?
Thank you, Roger, and thank you for having us. We're delighted to be here. I had the great privilege of meeting Kari a very long time ago. Of course, as you know, but many don't, our two older children were found to be allergic to nuts, Spencer to peanut and Violet to all the tree nuts, very early days when they were super young. And that led us on a long journey. We happened to be at a wedding one time, seated across from this incredible couple, and we started to talk about food allergy, and they said, "You haven't met Dr. Kari Nadeau at Stanford, but she's the worldwide genius." And we said, "No, we have never met her. We were just avoiding the nuts at that point. We didn't know there were treatments available." And we got to go down, we made an appointment. We had the great privilege of meeting Kari, and we started down the road of these incredible clinical trials, which she'll tell you about. But the best part of the story is that Kari had read my book, and I pulled it off the shelf. Remember this old girl? She had to be dusted off, but it turned out all those years ago, Kari was a fan of the book, and she had read about all the great Shaklee products in the book, and she was using our cleaning products. And of course, we provided many more. She believed in all of the things that Dr. Shaklee spoke about so long ago and that Roger and I have been talking about, and just about how great Get Clean is, and we'll roll back to that. But that's how I got to know Kari, and that's how I started on this crazy journey, which is led to this incredible book, and I'm so proud of it, and thank you for featuring it.
Thank you, Sloan. Dr. Nadeau, the book is called The End of Food Allergy, and there are so many families who have this that wake up every day terrified about what will happen to themselves or their children or family members. Tell us more about what do you mean by the end of food allergy, and tell us a little bit about the science that you discovered that led to the inspiration of this book.
Well, thank you so much, Roger. It's a pleasure to be here with you and with Sloan and with your Shaklee family. It's an honor and a privilege to be able to think about the end of food allergy. And I always like to think about beginning with the end in mind. And that end is in sight. And the reason why I wanted to write this book with Sloan was because we have the end in sight, that it is possible to think about a cure for food allergy now, thanks to our science at Stanford, but a lot of science that's occurring throughout the world. And then I also do a lot of work in the book with Sloan to talk about when you do have a cure, when you do have a therapy in hand, let's base it on science. Let's base it on a lot of pioneering work from families and patients that went through clinical trials. But then also let's talk about what are the patients feeling, how are families dealing with this? And because it answers an epidemic and it answers an issue that is facing so many people throughout the world, we also need to understand what's causing that issue, what's causing that disease. How do we get at the root of the disease and think about preventing it? And that's where working with Shaklee, and that's where working with Shaklee products is part of that end of food allergy, part of thinking about how do we prevent disease before it even starts, and how do we treat the disease and make sure that if we're going to treat it, that we look at the body as a whole and give good nutrition and get good behaviors to be able to allow a person to live a healthy life. So that's why I'm so excited about the book, because it is the end of food allergy, but there's a lot of things involved in ending food allergy for any one person.
Dr. Nadeau, tell us a little bit, because your fundamental insight of the treatment and cure of food allergy is counterintuitive in a way from what patients would expect. Can you just share with our audience what is the secret that you sort of developed and worked on from clinical study after clinical study?
Well, I think what's interesting is that this has been going on for almost 100 years now, is that by giving back the person's allergen very in small amounts, ever so slowly, so that you build up their immune muscle, as it were. And this is not a new concept to me, but it's a new concept in the fact that we decided that we shouldn't just do one at a time. If someone is allergic to cashews and peanuts and almonds, that you shouldn't have to be desensitized to almonds and then peanuts and then cashews. That could take 15 years. Instead, we decided to do it all together because the body's seeing these as proteins. And so we carefully adjusted the dose. We carefully monitored the patient. This is personalized medicine, but it's also a personalized approach to the person themselves. We wanted to make sure that if we were going to give this therapy, we looked at their mindset. We helped them with anxiety. We helped them with looking at their own goals. How do they want to achieve being able to eat out at a restaurant and eat out with friends? No one should fear eating out, because this is part of our social life. This is part of who we are as a society. So I really wanted to create a methodology that could help the immune system stay strong and stay sustained and stay healthy. And that requires a lot of things outside of just giving the food. And that requires good gut health. That requires a good, healthy outlook. But importantly, it's also to make sure that it synergizes with the person and how they're feeling about their therapy. So that's what we created, and that's what we talk about in the book.
So Sloan, you drove our kids once a week down to Dr. Nadeau's clinic in order to go through this immunotherapy technique. Do you want to describe for everybody what it's like from the patient side and what it was like for the children, and then also what it made you feel as a parent to finally have your children be desensitized and not be so terrified every time they would go out and maybe have a anaphylactic experience?
You know, if you don't have food allergy, you don't realize that this is a global epidemic. 1 in 13 people in this country has food allergy. That's a lot of people. We had the unfortunate circumstance of having these 2 kids, and we were those parents. We were scared. We would go to restaurants frightened, and you never know what's on the menu, and you think they're telling you what's in the food, but in fact, sometimes people make mistakes. So we got to meet Kari, and we started on what's called OIT, oral immunotherapy, one of the many therapies that Kari is researching. And our kids were pioneers. They were really at the beginning. We didn't understand that at the time. I drove them every week. They were fed these tiny little amounts of the things that they knew could kill them, which was in and itself very, very frightening. And over time, we increased those amounts to the point where Spencer was actually able to eat a Reese's peanut butter cup. He didn't think it was as delicious in the end as he had hoped it would be. But the fact that he could eat that, the fact that we could even have it in our home, really talks so highly about Kari and the science that's developing all over the world. This book is the symbol of hope. It's about the other side. It's about the fact that our kids are now going to college, and we don't have to worry about what they're going to eat or what party they're going to go to or who they might kiss and what candy bar that boy might have had. Sorry, Roger, you didn't hear that. But that's the reality and the truth for all food allergy parents. And so I feel not only this enormous privilege that my kids got to have oral immunotherapy, that it is now going to be possible all over the world for children everywhere, but now there's this book, and thank you, Kari, for bringing this book into the world that will really help people understand what the road is and the great hope and promise and the science that is coming fast and furious to reach the end of food allergy.
Yes, I just want to talk about the book briefly because I had the I've read it. And what I found was so compelling about it is that it explains the history. And I think one of the things that we try to do with our Shaklee family members is educate people about ways to live a healthier life. And it really was an eye-opener for me, even having children with that, of the history of it. And at the end of every chapter, you have summaries of exactly what to do and how to put it into play. And one of the things I would ask you, Dr. Nadeau, is the immunotherapy that Sloan described was done in a clinical setting. So right now, from advice to people around the world who are listening, what is it that they can do to be taking care of themselves and help sort of prevent and address this issue of food allergies?
Thank you for that excellent question. It is true that for what is in our hands, we should make sure that we're living good, healthy lifestyles and make sure we know that knowledge. And that's where I feel like Sloan's original book that inspired me to be able to think about this next book, which is Greens Goes with Everything. It's exciting to know that healthy living practices are important, and that should be adjunctive, that should be together with the fact that if you are going to undergo immunotherapy, that you do it in a place where there are trained personnel that know how to give this carefully. People can have reactions during the process of building your immune system against the allergen. You're giving back the thing that someone's allergic to, so you're going to expect them to have allergic reactions along the way. And to do that in a careful process with trained individuals, with a doctor's office, this is seen as a drug. The FDA this year, one of the exciting things about this book is that it also is aligned with the fact that the FDA approved a drug this year for food allergy. How exciting is that for the first time ever? And so with that, you need to do this in the clinic. You need to do it with trained personnel. There are private clinics, there are academic clinics that one can do this in. Thank goodness the FDA approved. But it is all about healthy living practices, that people can start this therapy, but in addition, pay attention to your health, pay attention to making sure that you use less toxic chemicals and you use good vitamins and you make sure that you have good gut health. So all of that encompasses good, healthy living on top of doing immunotherapy.
Yes, you have an expression in the book that you refer to as the 5 Ds to help you with food allergy. Can you just mention what they are for our audience?
Sure. So one of the things we talk about in the book is reacting to a disease, i.e. giving therapy, but also being proactive. How can we prevent, if someone already has food allergy, how do we make sure that that person doesn't get more food allergies? And then how do we make sure if someone has an infant at home and they're worried about whether or not that infant could get food allergies, how can we prevent them from having the risk of food allergies? So what's wonderful is that that knowledge is in hand. And I'm so glad that you're having these types of symposiums for your Shaklee family, because with that knowledge and with the book, people can take it into themselves and think about how to work with these 5 Ds. And let's talk about those. So what we have learned from around the country and around the globe is that there are certain things that people do that have increased the risk of food allergy. For example, having a lot of dry skin. When eczema occurs or the breakdown of the skin barrier early on in life through a lot of detergent use that's too toxic to the skin of babies as well as adults up until we're 100 years old, we're using detergents that could hurt our skin. And what happens is when the skin breaks down, dust from the air, especially allergens, activate our immune system. They get into the underneath of our skin, activate it, and they activate the allergic pathways. Our body sees it as an outside foreigner and it spews out mucus, it spews out lots of problems, it starts to swell and it starts to itch. So with that, those are allergic reactions, but that's what dry skin can do. In addition, what we've learned is that dirt, being around good dirt, being around good microbiota, having good gut health is also important. That's a second D. Thirdly, living with a dog at home is important. Not everyone can live with a dog at home when they're in their first year of life, but we know that dogs bring in environment and bring in different microbiome from the environment, and we think that that's important too. The other thing we've learned about in terms of the Ds is that diversity of diet is critical. And that we used to think that we should avoid, not eat egg and peanut and milk for infants, especially until they're about 3 years of age. And that turns out not to be true. A lot of well-meaning people developed those guidelines back in 2000, but when you actually look at the data, after the year 2000, the rate of food allergy went up. Sloan talked about the fact that about 8% of the US children have food allergy. That's a real number. And in other countries, it's climbing as well. In China, it's 8%. And in the adult population, it's almost 10%. And so a lot of adults are getting this disease now for the first time. And so we need to think about prevention. And so with the 5Ds, there's also an issue with making sure that we understand and complement some of the items that we've learned about from DNA and from genetics. And I want to really make sure that your wonderful family at Shaklee know that it's not all about DNA. A lot of people are born without having any family history of allergies at all, and especially food allergies. They can happen for the first time in families. And that's important for everyone to know. And it's doubling every 10 years. So that's more than just a generational effect. There's something in the environment that's affecting us. And what we need to do is take that back in our own control and help out with dry skin, help out reduce detergent use, help out with diversity of diet, make sure that we have good dirt or good microbiome. And what we like to say and what we talk about in the book is that through the skin, allergies can begin. Through the diet, allergies can stay quiet. So even if you do have eczema, you can use good skin care to create a nice skin barrier, and then also help your gut so that you can diversify your diet, get those good foods in, and also have a good microbiome to have a good overall healthy living lifestyle.
That's fantastic. Well, again, this is so aligned with our mission, is to both give people information and then provide a solution for them that's affordable and accessible. And so we've put together your 4D pack. The dog is on your own. You have to do that. Addressing the issue of non-toxic detergents and clean moisturizers for your skin, and the vitamin D and the probiotic for your biome. We put it together into a special pack, and we're going to donate a portion of the proceeds to continue the great work that's being done for food allergy research at your direction, so that we keep advancing the state of that. And so we're excited that people can share the information that's in the book and also share some products that allow them to help stay forward. Let me see if I can just recap a little bit. By the way, I just want to tell you how impressed I was by the people who have blurbed on the back of your book. And I think it's the first one is you have Priscilla Chan, who is a medical doctor, the wife of Mark Zuckerberg, the founder of Facebook, and also Sheryl Sandberg, who's the chief operating officer of Facebook. And I know both of those, they have referenced that their children have gone through and had the same experience that we have. And when people, particularly, Priscilla's a doctor and a medical doctor, and it's just wonderful to see your impact. And I know, Kari, that you are a workaholic. The times that your day, you may be the one person I know that starts earlier and ends later than I do every single day.
I don't know about that. Yeah.
And it's just, your dedication is awesome, and the people who you've treated are so grateful. But I know your mission and goal is to not just help the ones that have gone through your clinic, but really help people everywhere around the world, right?
Absolutely. And that's what's so critical about the book, is to make sure that it gets out around the globe. We're so grateful for being able to be here today. Sloan and I had a major purpose in making sure that we could educate with scientific knowledge. There are a lot of myths about food allergy and food sensitivity as well. And so we want to help people have a book, a go-to book, to be able to end food allergy, but also understand, okay, if I do have food allergy, what do I do about it? How do I manage it best? And if I have a food sensitivity, how is that different from a food allergy? How do we make sure that we help people get the tools for diagnostics and to bring some questions to their physicians so that that really helps them? And we wanted that to be available to the US, but also around the globe, because food allergies and food sensitivities are global issues affecting all ages, all ethnicities, all socioeconomic groups as well. So I'm so grateful that we have this opportunity, and we're very lucky that we have been able to connect with many families, those of you who you mentioned on the phone and other physicians as well. I think good care, good vitamin care is critical. I'm so glad that, Shaklee products also think about these. We learned very early on that vitamin D and other vitamins play a very important role in establishing good immune balance. So it's things like that that we're learning, and we wanted to get that information out to the world. And I'm so grateful to not only be a physician in this, but also to have Sloan as a parent's point of view, as a lay person's point of view, and being able to create a story and to be able to create science so that it's very presentable and digestible to the readers.
Well, I think you both have accomplished it. It's been terrific to watch on the inside, the partnership between the years of your clinical work and your insights and Sloan's way of bringing it to life from a perspective of making it accessible for everybody. So I'll just recap with the things that I learned just even from this conversation, right? One, this technique that you sort of brought to the next level of holistically giving people small amounts of the allergen to desensitize them is groundbreaking and breakthrough. And it basically is the beginning of the end of food allergy. And then how people can maintain it by impacting sort of choices that they make to live a healthier life to keep the food allergy at bay. And then I also know that you're passionate that the environment that we live in has to be healthy for all of us to be healthy, because the impact of climate change and pollution and these things also have an impact of that, and more to come. But Sloan, do you want to say any parting words at the end before we wrap up?
I'm just going to add that I'm really actually delighted that this work that I really didn't think had anything to do with your work, turns out it has everything to do with it. And it just goes to show me that, at Shaklee, you're doing the right thing all the time. And it was so obvious when I wrote Green Goes With Everything. And who knew that as we started to talk with Kari and the science, that Shaklee and the company's products would play such a big role in this part of the world as well. Kari knew it 12 years ago when we first met, but it's come full circle now with this kit. And I'm just delighted that we can bring these things to people in an easy, accessible way. And I'm proud of the book, and I'm proud of the fact that you've introduced it to the Shaklee family. So thank you.
Well, I think all of us have a debt of gratitude to Dr. Nadeau for devoting your life energy to this issue. And it's an issue that doesn't affect everyone, but it affects many, many people, and it's a growing number of people. And I think with both education and information, concrete action, that we can address this and make food allergy a thing of the past. So on behalf of all of us, thank you very much for all that you do. I'm always amazed and inspired to hear from our scientists in the world who are at the cutting edge of treating major issues, and you're a hero to all of us. So we express our gratitude. And Sloan, thank you for bringing this book to life. It's a great read, and it's so important for so many people. So we appreciate it.
Thank you so much for having me on the show, and really appreciate this. So thank you to both of you, and thank you to your families, and the children and the patients are the heroes. They deserve so much credit. So thank you.
Okay. Well, that wraps up this session. Thank you to Dr. Kari Nadeau. Thank you to Sloan Barnett. The End of Food Allergy is their book. It's fantastic, and we hope that you have learned something from today. Okay, have a great day.